Hello, everyone, and welcome. My name is Angela Ward, and I am coming here today with OPENurses. I am one of the founding members of OPENurses, and we are here with our fourth in our new Nurse Luminary interview series. Today, we're going to be speaking with Julie Megler, so I'm really excited to have this conversation today. As you're coming in, would you please pop in the chat where you're watching from? If you're watching live, it's always fun to know who's joining us. If you want, you can actually maybe even add your title. Are you an RN? Are you a nurse practitioner? Are you an ally in another field? It's always great to know who's here and who's participating. If you're watching the replay, please make sure you pop replay in the comments, and we're going to get started. So, here we go. We got a few people coming in. So good to see you. We will be talking for about an hour. We will be opening the floor up for questions and answers at the about 45-minute mark, but we're going to just see where the conversation takes us today. Please remember the Organization of Psychedelic and Entheogenic Nurses is a professional organization, and we're really dedicated to forwarding our roles as professional nurses in the emerging psychedelic field. So, hi everyone. So good to see where people are coming in from. Wonderful. So let's get started with our interview today with the fabulous Julie Megler. All right, I'm going to read you her bio. Her initials after her name are PMH-NP, which I'm assuming means Psychiatric Mental Health Nurse Practitioner. Is that right? I hope so. Julie Megler is a board-certified nurse practitioner in psychiatry and family medicine. She received her Master's of Science from Nursing from the University of Miami, Florida. After graduating, she worked at an emergency room in Detroit, Michigan. Her ER experience illustrated the gap between medical and psychiatric care and how the mind-body connection is often ignored. These gaps in care encouraged Julie to pursue a psychiatric mental health nurse practitioner certificate at the University of California, San Francisco, so she could develop a practice that integrates medicine and mental health. This path ultimately inspired Julie to co-create Sage Integrative Health, an integrative mental health and wellness center in Berkeley, California. Sage Integrative Health strives to weave together allopathic and holistic approaches to health, incorporating psychedelic assisted therapy as is legal. She is an approved therapist by the Multidisciplinary Association for Psychedelic Studies, MAPS, for their upcoming extended access program using MDMA-assisted psychotherapy for treatment-resistant PTSD. That's so awesome, Julie. In addition to her clinical work, Julie has completed the somatic experience trauma training. She's a mentor at the California Institute of Integral Studies for the Psychedelic Therapies and Research Program, a board member of ERIE, the Entheogenic Research, Integration, and Education Organization, and she was trained in ketamine-assisted therapy with the Korea Institute and was the program director for the Femtheogen Collaborative sponsored by the River Styx Foundation. Her current work is focusing on ketamine-assisted therapy, medication management, somatic therapy, and teaching about psychedelic-assisted therapy. She has also spoken at several conferences, facilitated workshops, and co-authored book chapters on therapeutic uses of psychedelic medicines and integration. And just before I call her on screen, I want to share a little personal story that I have been a fan of Julie since I met her. I had the pleasure of seeing her speak at my first ever psychedelic conference in 2015, the Visionary Convergence in LA. My mind was blown being there, and then seeing a nurse talking about this, I was like, this is the person I want to be when I grow up. I want to be just like her. So please welcome everyone, Julie Megler. Yay! Hi, Julie.
Hi, everyone. Yeah, it's so lovely to be here, Angela. I remember that moment when you came up to me after my talk that day. It was like 100 degrees in that church that day, and everybody was sweating. And I always like to bring an aspect of vulnerability and my own experience into my talks. And you were just so appreciative of that connection and that vulnerability and the wisdom that I shared through that talk. So
yeah, it was so good.
Yeah.
Yeah, thank you. And I think that was the first time that I really recognized that a nurse has a very important role in the psychedelic field, which is just so exciting. So, would you tell us a little bit about the trajectory of your nursing career and how you came to be involved with psychedelics?
Yeah, definitely. So it's really interesting. I've always been interested in altered states of consciousness since I was young. Grew up in the Detroit area, watched friends kind of fall into the rave scene and use psychedelics in a very unintentional way, which was really off-putting to me.
Mm.
And then when I was in school, in nursing school at the University of Miami, I was dating a guy at the time whose brother was actually volunteering for MAPS, for Multidisciplinary Association of Psychedelic
Wow.
Studies. And so he was the one who told me about them, and I quickly logged onto their website and ordered back issues of all of their bulletins. And I had read in there Rick Doblin's um, piece around "So You Want to Become a Psychedelic Therapist," and he talks about how licensure and kind of a legitimate means to be able to move this work forward was really important. And at that time, I was at a crossroads. Do I pause in my coursework right now and go and work as an RN for a few years, or should I keep on pushing through and go straight into the master's program? And ultimately, that article actually really inspired me to keep on pushing through and get my nurse practitioner degree, finish my master's in nursing. And then I made that side jaunt to Detroit to get some work experience, and then ultimately realized that I wanted to focus on mental health and psychiatry, and chose to go to the UCSF program because I realized that if I wanted to really find a way to be integrating in psychedelic assisted therapies into my work, that the Bay Area was going to offer a lot more opportunities um, for that than being in the Detroit area. So I came out to the Bay Area, and first couple of months there was a conference at Oakland, that one of the psychedelic science conferences. And then within the next year, I'd been invited to give a talk about ayahuasca and PTSD at the following MAPS conference, and everything just kind of snowballed from there and ultimately led to kind of creating Sage Integrative Health with my co-founders, Genesee Herzberg, who's a clinical psychologist, so that we could try to find ways to really bring psychedelic assisted therapy into the work while really holding an integrative approach. So it's not just psychiatry and therapy, but also how are we thinking about the whole body system and the mind body spirit connection.
I love that. I think
Yeah.
that's really a beautiful way to approach this. It seems more related to the traditional uses in many ways. So tell me how you think nurses carry a different perspective into this field. What's special about nurses and what do we bring, um, yeah, versus your average other fields working in this arena?
Bedside manner. I'm sorry, that was a bad joke. That was a bad nurse joke.
We'll just keep it in this little group here.
I'm just kidding. Both my parents are physicians, and they actually have great bedside manner, so it's more of a joke than anything else. But I really think that the client relationship piece is a huge part of it, in that from the patient care side, we're spending so much time with the client themselves. We're part of creating a safe container for people to do really deep healing work, whether or not that be psychological, psychospiritual, emotional material, or on the physical level. And so there's an aspect of care that I feel like nurses really hold. And then I think from a practical perspective as well, as things move over um, into the clinic actually being utilized in the clinical setting, I think there's a tremendous need for nurses because of things like us being able to medically monitor as well as administer, and then depending on what your nursing background is in, actually it being in your scope of practice to do the therapy work as well. And then the one that I don't think people often enough talk about is that as nurses, and a nurse practitioner, we all have RN licenses. So it's in our scope of practice to put our hands on clients. And that's a huge thing, is that so many of the therapists, there's still this sort of disconnect of like, I know, especially in psychedelic assisted therapy, that hands-on work is really important, but my licensing board makes me feel terrified to even touch a client because I feel like I could get sued or whatever it may be. And so I think it's interesting that nurses have the hands-on license so we actually can make contact with our clients.
I think that's essential and a really, really beautiful piece that we offer and generally have more comfort with. Mm-hmm. Could you tell me a little bit then about how you came to the somatic experiencing training? Because that seems like a real beautiful blend of the nursing practice and hands-on.
Yeah, definitely. So it's interesting, one of the things that I forgot to mention around how I got to where I'm at is that I have had a long time interest in weaving together both these clinical approaches as well as learning more about traditional entheogenic communities. So I've spent a fair amount of time in Central and South America studying a variety of different entheogenic traditions. And within one of the contexts of retreats that I was on, I was studying ayahuasca or learning about ayahuasca and participating in ceremony in South America with that. And one of the facilitators of the retreat was a big Peter Levine fan and mentioned Waking the Tiger to me. And I was going through a particularly hard time at that moment. And he thought that reading that book would be a useful integration tool for myself. So I read that book and then kind of sat with that, was super inspired. And then multiple years later, was back in Mexico studying with the Mazatecs. I was down in Huautla learning about their tradition and kind of had a humbling experience, to say the least. And kind of through that came back and was like, I think I'm supposed to actually start working with an SE therapist, with a somatic experiencing therapist, who's actually still my therapist today. She's amazing. I believe in like the integration team, and I think having a therapist as part of that team is a really useful tool. And then within probably 6 months to a year of that, I saw just how profoundly important it was for me bringing in SE to my own integration work with my altered states of consciousness work, as well as just personal healing work and growth work, that I started the SE training. And so I did that training because I wanted to be able to bring that work in with my clients, as well as understand it more deeply within myself as I was doing that work with myself too.
Wow. Sounds like there's quite a tale in that little bit that you just shared with us. That leads me to the question. There's two pieces here. One is, how has it been for you to kind of out yourself to whatever degree with your psychedelic experiences, if you have, or you just shared this little piece with us, and also what has it been like? Have you met any resistance from others professionals in the field, and how do you protect your license?
Yeah, definitely. So, there's a saying within the psychedelic community of know your medicine. And it's interesting, it's a little bit contradictory to what you would hear in terms of other traditional, say, psychiatry, even, where know your medicine within the psychedelic field is like you would never give somebody a psychedelic medicine that you didn't personally have a deep relationship with in some form or another. And I think that's critical. Now, I'm a psychiatric nurse practitioner. That doesn't mean I've tried really any of the antipsychotics that I've ever prescribed. So I want to just kind of name that hypocrisy a little bit there. But I do think it's different when it comes to altered states of consciousness, because the other thing along with that is like you can really only take others as far as you've taken yourself. And so until you've done your own deep personal healing and growth work, and you're very familiar with that territory, you can't really do as sufficient of a job of midwifing others through that growth process and healing process themselves. And so I think I kind of hold that similarly to how in most psychiatry or psychotherapy training programs, the part of the program requirement is that you're in therapy yourself. And then in terms of outing myself, I think it's really important to destigmatize the psychedelic work and be honest about my personal experiences. And then in terms of protecting myself, I've been really fortunate enough to be able to travel abroad for these experiences. So it doesn't feel like a conflict of interest or a concern for me in terms of sharing the experiences, because I've done a lot of work in Mexico and in Peru in particular. So
Thank you for that. There's so many things you just said that I think the part I'd like to speak to a little bit or ask for a little more depth. First of all, thank you for saying the part about destigmatizing psychedelics. I think that there is real importance at whatever level we feel comfortable and safe to do so. But I like what you said about we can only take others as far as we've taken ourselves. And I wonder if you feel that is medicine specific. I know at Sage you are working with ketamine assisted therapy, which is our only legal psychedelic at this point. Is that something that nurses might get experience with if they're interested in moving into this field? How might they lay some preparatory work if they're interested in becoming a psychedelic nurse at some point?
Yeah, so there's actually quite a few different ketamine-assisted therapy training programs. Sage Health and Sage Institute currently are collaborating on an online training program that does have an experiential component with sublingual ketamine along with it. Korea Institute was doing trainings. I think they put a pause on that for the time being. And Polaris in San Francisco is doing trainings currently. Healing Realms, I know, used to do some trainings. I'm not sure where they're at right now, as well as Temenos up in Petaluma. And one of the beautiful things is that I really appreciate about all the organizations that I named is that we have a very collaborative relationship with each other. So even though we're all in the Bay Area, we really share a lot of resources with each other. We cross-refer to each other, we consult with each other, and all those things. So those are some of the training programs that I would just name out loud. And then I know that the CPTR program, which I know you graduated from at CIS, is working towards adding an experiential component. I don't think they're quite there yet, but they're hoping to add an experiential component to their training program. And those are the main ones with at least with the ketamine work at this time that I know of. I know Phil Wolfson as well, who's a pioneer in the ketamine assisted therapy world, has done many trainings as well. So I want to give him a shout out as well. A little bit of grandfather of the ketamine work.
That's who I did my ketamine training with, was Wolfson. It was great. Do you think that adequately prepares someone to be with someone in a psychedelic space, working with people with ketamine?
If working with ketamine adequately provides people with experience with working with other medicines as well. Every medicine has a different quality to it. And so I think it is really important, like I said, to know your medicine before working with other ones. I think there's similarities in a lot of things around structure. But even say like with the MDMA training that I've done with MAPS, there's a huge difference between with ketamine, you're usually in the room with somebody for no more than 3 hours. Whereas with MDMA, you could be in the room with somebody for 8 hours. So learning how to pace yourself with that experience. Both medicines have different side effects. They have different contraindications and medical concerns that you need to be concerned about. And the landscape and the territory has some similarities, but they can also be quite different from each other in a lot of ways too. So because each medicine has such an individualized experience to some degree, to know what would be an appropriate indication for that medicine, if like say you're an NP and you're prescribing, in that way it's useful, as well as like being familiar as to like what are some of the pitfalls or things that could come up in the experience. For instance, like with ketamine, like in high dose ketamine experiences, knowing to orient people towards the fact that like it could be very confusing and it might not have a lot of literal translation in the same way that working with other medicines might. And then I think when you're working with other plant medicines, for instance, say something like ayahuasca, that actually really requires like a full-on, like I really, really emphasize to people that I think that involves a full-on apprenticeship, like you going to a community where where that is part of their tradition and spending an extended period of time, and that becomes kind of sort of your primary focus of area and training, and that's just working. That's like a whole other like doctorate level of training and degree. It's not something you can really learn in just a training over a few months.
Yeah, absolutely. I think you make a really, really good point there. I have had people ask, do you feel that nurses require advanced degrees to start moving into this type of work? What are your thoughts about that?
I personally don't. It really depends on what sort of work you want to be able to do. I think that having a counseling background is helpful, in terms of how to hold a therapeutic container, building rapport, the relationship. Like a lot of that is, I think, just natural and inherent for nurses. But inevitably, when working with altered states of consciousness, there is psychological material that's coming up. So learning how to assess for that and hold that and contain that is useful. But I don't think you necessarily need to have a higher level degree. Say, for instance, if an RN were to get a somatic experiencing certificate or a HICOMI certificate or an IFS, internal family system certificate, there's all sorts of other ways to get additional counseling experience that don't require necessarily getting a whole other degree.
Absolutely. I think that's really true. I love that. I'm an RN and I'm nurse coach training, which is a little different, but still kind of works on some of that therapeutic container. What other skill sets do you think would be important for nurses to develop in order to work in this field? Maybe not just in the medicine experience itself, but kind of all around.
I think and one that I'm personally still working on, I think some sort of bodywork training, it can be really useful, whether it be something like craniosacral, basic massage classes. One of the things that I think is really part of the psychedelic experience is that it really brings attention to how disconnected, as I mentioned in my bio, our mind and bodies are, and that our bodies are places of holding a tremendous amount of emotion, and that because culturally we're kind of taught to ignore our bodies or not trust that sensation, we never really develop the fluency of language to understand how to translate what's going on in our physical body into understanding what a deeper emotional process is that might be underlying it. So touch work and body work can be a really amazing way to help clients relearn that language and how to learn how to translate that, and then you can work together with that. So I'm a big fan, but I also have a very somatic approach to how I hold things. So that would be one of my biggest suggestions. And I'll have to think about that a little bit more to see if there's other things that come to mind, but nothing at the immediate moment.
Well, I wonder, because you've talked about your work with Sage, and that you're really integrative. So I'm wondering, are you bringing some functional medicine approaches? Are you bringing in nutrition? Are you bringing in any other components that might be helpful for us to broaden our understanding in as nurses?
Totally, yeah. So maybe if I just lay out the structure of what Sage has, that can give an idea of what some of the great options are. So at Sage, we have psychiatry and therapy, and then we also have naturopathic medicine, nutrition, acupuncture / herb consultation, whether that be Western herbs or TCM, traditional Chinese medicine herbs, as well as body work. And so we've been interested in bringing in a functional medicine doctor as well, but one of our nutritionists actually orders a lot of kind of like functional nutrition, she can't order them, but she can interpret some functional nutrition lab work as well. So traditionally what we've done in the past, COVID kind of shifted this, but we're now trying to move back into it, which is that when people come in for their ketamine work, we would actually kind of require a package. And the reason for requiring the package is because it was created off of what we felt like was absolutely essential to be able to do like a good complete chunk of work, like at least a chapter. You're never fully complete in any like healing work or process that you do. There's always aspects to revisit. And so we would require, the medical intake, the preparation and integration sessions, a suggestion of committing to a series of 3 ketamine sessions. And then along with that, people could choose, but were required to also participate in 3 integrative services. So those integrative services people could choose from nutrition or body work or acupuncture. So essentially, so to kind of like bring that in of like, you need to, like, if you really want to see change and make, see consistent change in your life, that you can't just take the medicine, you've got to do the integration sessions. And you can't just do the integration sessions, but you also have to be working with your physical body or in other sort of behavioral changes along with it.
I'm like cheering you completely, like, yes, yes, yes. Could you say how you came to that understanding? Was that from personal experience or from what you've learned just working with other people? How did you come to that perspective?
Yeah. So it's kind of a beautiful story of that was kind of what brought my business partner, Genesee Herzberg, and I together, was that we both shared this vision about creating this clinic because we both had personal experiences around kind of needing to get support and knowing that we needed to find a variety of different modalities, but that everybody was in a different place. We would get referrals from different people and not really know who the best referral was to go to. And that ideally how lovely it would be to actually have all those things offered under one roof. And that it varies for each person in terms of what that combination of services is. But that was what I was talking about earlier. If anybody caught me talking about how I feel like I have an integration team, like for me, my ongoing work is with my SE therapist I see weekly and my acupuncturist who I see pretty much weekly. And then I have, my supervision that I do as a nurse practitioner. And then I also have mentors, other people who've been working within entheogenic communities all around the world in various contexts, and just being able to talk to them about this work. And so, I think it's important that's essentially how we came to it, is that both Genesee and I had been through our own healing journeys, looking for a variety of different services and wanted to be able to create a place that offered them all in one roof.
I think it's so great and really truly what all healthcare should be, not just psychedelic therapy, in my opinion. I think that would be great if everybody had an opportunity to have a deep dive into their wellness. I love this piece that you're bringing in about mentoring too, about also being this kind of lifelong student, it sounds like, as well as mentoring others, because you mentioned you're mentoring for CIIS right now. Tell me a little bit how a nurse might find good mentors. What might a good mentorship look like, or what would be some hallmarks?
I wish I could say I felt like there was a good structure in place for that. I've, truthfully just been blessed in that I've had curiosity. I'm not afraid of being persistent. And so I've just been lucky enough to reach out to people over the years who have a lot of experiences in these variety of ways. And so, I've been fortunate enough to be on several retreats with, say, Gabor Mate, or part of how I even got into this whole world is that I ran into Rick Doblin at UCSF as I was a student there, and I recognized him. And then he kind of, through that, put me in touch with some of the elders that I know in this community. And it was kind of through that I got to know, for instance, like the women who are part of the Women's Visionary Congress. Maria Mangini is another nurse, who kind of luminary in this field, who I have a lot of respect for. So
I believe we're interviewing her. I believe we're interviewing her next month or the month after. Yes.
Oh, great. Well, if you ever do a panel I think that could be a real hoot to get a handful of us at a panel together sometime.
Noted. Anybody in the audience want to hear a panel of psychedelic nurses talk? Because give us some thumbs up, or heck yeah, if you want that. That would be great.
I feel like on that note, I want to give a shout out to Andrew Penn, who I know helped co-found OPENurses, because he was teaching. He was a guest speaker while I was a nursing student at UCSF, and he was talking about I think it was a psychopharmacology class that he was teaching about, and he was talking about the psychopharm of some of the psychedelics, and I was like, who is that guy? And then like a year later, he read my bulletin article in the MAPS bulletin, and he's like, don't I know you? He reached out to me, and then we reconnected, and we've been great friends and colleagues since then. It's been very sweet.
That's so awesome. The psychedelic world is kind of small, actually, it turns out.
Right.
That's so awesome. Gosh, so many other good questions. Let's see. I know when you mentioned sitting with people for 3 hours for ketamine sessions or even longer for MDMA sessions can be quite a toll on us, physically, emotionally, mentally. And yet we also have a profession that is one that prides itself oftentimes in burning the candle at both ends. And there's a badge for working 12 hours without peeing or, no sleep.
Not taking a break.
Yeah. I know. Badass. How were you able to learn self-care practices, and what are some that you use to really optimize your ability to care for your patients that you're doing ketamine therapy with?
Yeah, what's showing up for me right now is that, I think like many of us, when first doing this work, there was this sort of like, oh, I need to do everything perfectly. I don't want to move at the wrong time and make a loud noise, or, step out and use the restroom if I need to, or feed myself if I need to. And then I realized that, again, like I can only show up for the client for as well as I'm taking care of myself. And that if I'm needing to reposition myself, if say they're needing some sort of hands-on support, that's okay. And that one of the ways in which to do that is actually around, it kind of helps with the psychoeducation. And when you reorient towards it, is less of like, oh, I'm, prioritizing myself over the client, and think about it more as like, I actually could be modeling something here that's really important for the client to see. And that's on several levels. One, like you're showing the client that self-care is important, and that you will continue to hold the container while you provide yourself with self-care. So there's certain things like letting people know ahead of time, like, I'll be sure to let you know if I need to step out of the room, and I will not step out of the room if you're in the middle of a deep process, or if you're in the middle of a high dose experience. Like, you're never going to do anything like that if the client's safety is on the line. As well as, I think, or what I see often with a lot of clients is that there's everybody's caretaker side comes out, right? They're like, are you okay? There's a way in which it pulls them out of their own experience to be like, like I think most people get uncomfortable having all that one-on-one attention on themselves. And so by modeling that you actually are taking care of yourself and they really don't need to worry about you, I think is also can be therapeutic for a client in a way that they don't realize that they're needing as well.
Absolutely. So in the session, you do that modeling, which sounds really fantastic. And you did mention your integration team, acupuncture, bodywork, therapy, all of that. Are there other things that you would say are really essential for self-care that maybe nurses that have been working in hospital settings or such may have forgotten?
Some of this is the luxury of being more in a private practice setting, but I think taking control over your own schedule. When I was working in the emergency room, there would be days where I would see 45 people in a single day.
Yikes.
Yeah. And now I max myself out at 8 to 10. And a lot of my sessions are only half-hour follow-ups. So I max myself out personally at 4 to 5 client-facing hours in a day. And I know that for myself that I can, and granted, I'm managing a clinic, so it's a little bit probably more condensed than for most people. But right now, I only have the capacity. My system only has the capacity for seeing clients for 45 client hours, sometimes 2.5 days a week. And that's what I need to be able to keep on doing my work in a good way. I don't need to be doing 12-hour shifts anymore. I don't need to be seeing 45 clients jammed in at once. And I think part of what psychedelic assisted therapy is showing is that there are other models, but then of course we run into the bottleneck problem of how do we serve the population for all the people who are actually needing this care in a way that's affordable and accessible, which is also like a whole other conversation in terms of insurance reimbursement. And part of the reason why those unsustainable practices evolve for nurses is because of things around reimbursement and insurance coverage and various, tracking of costs.
Absolutely. I think that's one of the key roles that we can play as nurses in the emerging psychedelic field, is as advocates for patient care in that way. How do you, what parts of outside of just the direct psychedelic or patient care, how might we be better advocates for our patients or for the system as we're moving into this more perhaps medicalized emerging psychedelic field? What do you think some of the pitfalls are of legalization or medical use?
So I'm kind of hearing that as two questions. You're asking how we can advocate for clients, and then also what are some of the pitfalls of the legalization model.
Yeah.
So I think ways to advocate for patients is, I think it really depends on which setting you're working in. So if you're still working within the hospital setting, I think doing things like educating other staff around these sorts of things is really helpful and amazing. I remember when I was a student and I was doing some of my clinical rotations at the VA in San Francisco, talking to one of the psychiatrists there around kind of epigenetics and trauma and some of the research that was being done within the psychedelic field around epigenetics. And he was like, it was kind of like the epigenetics link was the bridge that allowed him to kind of think about and become more curious around psychedelic assisted therapy. So it's like finding ways for us to find research-based information and bring that into the clinical environment where people otherwise might not be so open-minded about it. And I think that's one of the things that I really love and appreciate about Andrew Penn's work is that he's really done that with Psych Congress quite a lot. He's on the steering committee and he's brought in the Midhoffers and all sorts of folks in the field to kind of try to help educate a broader audience that otherwise wouldn't know clinically much about this work at all. And then around the pitfalls question, I'd be curious if you could maybe elaborate a little bit more specifically around what your question is around the legalization efforts and stuff.
Gosh, there's so many questions I could ask there, but that's a whole long conversation. But I think when you mentioned the bottleneck component of being able to serve a certain number of people, yeah, and I know that there's so many people that are watching and participating that are interested in kind of helping to alleviate some of that burden. But I wonder if there's other areas that you see challenges in, maybe specifically related to the bottleneck or to who has access, perhaps.
Yeah, it's complicated. I'll say that much. I will say that one of the things from my perspective is that I'm a big advocate of multiple avenues of pushing this work forward. So I'm an advocate of both the research side of how MAPS is approaching things and trying to move through the FDA and the DEA and eventual descheduling and that sort of approach to drug policy reform. And I also am a big advocate for the decrim movement. I know there's a lot of different debates around which approach within decrim is the most legitimate. So I kind of take a step back in terms of saying that I know which of the many decrim initiatives specifically are the best ones. But I think either way, with decriminalization, you do offer the opportunity for more populations to have access to these medicines, and that we do need to think about things around standard of care and safety, and that also with decrim, populations that can't afford to pay out of pocket for services that clearly aren't being covered by insurance at this point in time and probably won't be for several years, that is another path forward, and that's another path of fighting the drug war. And so I'm in support of that, and appreciate everybody who's contributing to it on all of the different levels. So
Beautifully said. Beautifully said. Thank you for bringing out those other pieces, the drug policy, the decrim stuff. That made me think of something I heard you speak on once, which I thought was really impactful. It was impactful for me when you were talking about the difference between harm reduction and risk reduction. Could you riff on that for a second? You still have that thought in mind? You remember that?
Yeah, I was just gonna say, I remember that from a few years ago, and I remember it was really, I think, Annie Oak who pointed that one out to me, and we used to nerd out on those conversations a lot. She's one of the founders of the Women's Visionary Congress. And yeah, so I remember now. So with harm reduction, you're inherently portraying the idea that the substance is most likely to cause harm, versus holding in mind that the substance that somebody might be using has risks, but it doesn't necessarily inherently cause harm. And so this is, part of one of the debates around the decrim movement. So I want to be a little bit mindful around that, and that there's there's the concept of psychedelic exceptionalism. So I don't want to say like psychedelics are good, but hard drugs like, crack and cocaine and heroin are bad, because there's all sorts of, systemic racism involved within just that debate within itself. So I want to be really, really thoughtful around that. But I think, before I was even introduced to some of these deeper concepts around drug war and drug policy, was when I had first mentioned and been having these conversations around harm reduction versus risk reduction. And I think that's really the point, is that some substances inherently can be much more harmful. And that rather than saying, I'm taking a harm reduction approach to psychedelics, I'm actually taking a stand by saying I'm taking a risk reduction approach with my work with psychedelics, because I want to make sure that I'm informing people around the risks so that they can, if they choose to pursue psychedelics in some way, make healthy choices in terms of not only medically, but also in terms of like safety of the container and the set and setting and various things. And that as a clinician, part of my work is to hold a bit of a harm reduction / risk reduction approach in educating my clients. So
I love that. And I think that really does fall within the nursing scope of practice to non-judgmentally provide information. So I think that's a really beautiful framing to remember that we can all do that. I do see someone asking if it's time for questions yet. So I think it would be great to open up the floor for questions. If you have a question, you're watching right now, please pop a question in the comment and we'll get to them as they come through. The first question was, are we allowed to ask questions? So I'm saying now is the time. Yes, please bring questions. We'd love to discuss them further. In the meantime, while we're waiting for people to get their thoughts organized, gosh, I think like you answered so many of these good questions already. One of the ones I was going to ask, what advocacy role do you see nurses taking in terms of changing laws, policies, harm reduction, etc.? We just talked about that.
I mean, just like, for instance, with the Oakland decrim movement, I definitely was involved in a lot of the city council hearings and meetings, and it was helpful to have somebody who has a license in their background and could talk about their clinical work and clinical practice as part of that. Is we were hoping that the vote would move forward to pass it. So that's one way to get involved in policy work. So
I think that's so good. I'm really proud of you guys doing that work. That was absolutely amazing. I hope more states can follow through. All right, here's one question. Someone asked, could we please repeat the training programs quickly?
Yeah,
Thank you.
So Sage Integrative Health and our sister organization, Sage Institute, which is a nonprofit, we've been collaborating on an online training, which is in process right now. So you can't enroll in it. We'll probably do another one either at the end of this year or beginning of next year. Polaris is doing ongoing trainings. It's POLARIS. That has multiple modules to it. And then I don't remember where Healing Realms and Temenos are in terms of their trainings, but they have done trainings in the past. So it'd be good to go to their websites. And then there's also Phil Wolfson's training. I think he's just about to launch another series of trainings. And then there's the CIAS Center for Psychedelic Assisted Therapies and Research, I think is what that all stands for.
I think so. Yeah, one that I'm currently enrolled in is the Synthesis Psychedelic Practitioner training. It's another one, and that is also experiential, but you have to wait till COVID stops being a problem to go do. Yeah, and those are primarily for, well, I mean, I think the ones you mentioned first are primarily ketamine assisted therapy ones, except for CIAS and Synthesis. And do you know about the MAPS training at all? If that's going to be experiential at some point? The MDMA for PTSD trainings?
So this round, so for the FDA trials, they had approved an experiential component to it. For expanded access, the FDA denied it, but I know that MAPS is going to try to repeal it, and I don't know where they are in that aspect of the process, though. So
that's exciting.
That one. And then there's also Consciousness Community Medicine has been launching programs. They're just going to be doing their first cohort in Canada and Jamaica. So I think there's a little bit more to stay tuned around that, but I want to give them a plug as well. They're based out of the Bay Area too. And the Canada training, those are geared towards licensed professionals as well. So
I love it. All right, here's another question coming from Stacy Smith. What are your thoughts on the research that aims to take the psychedelic effects out of the psychedelic substances while retaining the therapeutic effects?
Oh, I have feelings about it. But
your feelings are welcome here.
Yeah. I've sat with my feelings around this question a lot, and initially my response is to have a little bit of a hard edge of that's taking the point out of it. Psychedelics can be a very uncomfortable experience, and part of that uncomfortable experience is oftentimes really facing and looking at things that are things that you want to kind of unconsciously avoid. And so if you take out the psychedelic effect, you take out that opportunity to really take a real close look at yourself, your patterns, your relationships, other things that might not be working. And I also really honor the fact that psychedelics do have a straight biochemical effect and a straight pharmacologic effect. And one of the things that I always tell clients is that sometimes you're at a place where you've been trying to access all the resources that you have, and you just can't get yourself to motivate, or you can't get yourself to reach the goals of the baseline that you would like to create for yourself. And that something that's just working on a pharmacologic level is really useful, and that in and of itself is also an ally. And that when you're needing to seek support, really thinking conscientiously around what type of ally you need to help you get there is useful. And so it was kind of a shot in the face for me to realize, or slap in the face, to realize that actually my judgment around taking the psychedelic effects out was me not being open to the fact that, again, you do need to meet your clients where they're at sometimes, and that's important. And that it was coming more from a fear place of, they were, everything's going to get clinicalized in the psychedelic aspect, and so much of what is the heart and soul of psychedelic work is going to get taken out of it, which I do have fear around still. I think when we see things with, big money corporate structures moving into the psychedelic space, like these are legitimate fears to see things get really clinicalized, and so much of what I love and appreciate about psychedelics being lost in the translation over, but that there is a time and place for also using psychedelics in this sort of therapeutic way as well.
I think it's really beautiful because you just gave us a modeling of checking your own psychedelic exceptionalism in a way as well, right?
Totally.
Because that's a really, really good point. And meeting that's such an essence of what we do as nurses, is meeting people where they're at and helping them from there. So I love it. Here is another great question from Henry, asking what other books besides Waking the Tiger focusing on healing trauma that you would recommend?
There is, I love all of Peter Levine's books. Those are all good. We were just talking about Bester Vanderkolk, as well as Stephen, is it Porges or Porges? I always say it wrong.
Porges.
There we go.
Mm-hmm.
I'm a big
polyvagal
fan
stuff
of polyvagal theory. I really love nerding out on that stuff. I think there's a lot there. And then there is another book, I think it's just called Healing Trauma. It was written by a physician, and I can't remember. I have the book on my bookshelf somewhere, although I just recently moved, so I don't know which bookshelf where. But if there's a way to add in the comments when you guys post on YouTube, I could look it up and shoot a link to that.
Yeah, that would be fantastic. There's a couple that I really like. There's one called Trauma Sensitive Mindfulness, which I think was a really nice one about approaching meditation practices without re-traumatizing people and asking people to go inward. And then another one that was I just
want to echo what you just said. Like, going inward isn't always the answer, and that can be re-traumatizing, and that's a really important thing for people to know. But sorry to distract you.
Yeah, no, please. This is your interview, my friend. But the other one that I really like is anything related to internal family systems. But I don't know if you've seen the book Somatic Internal Family Systems. Is a really interesting one. You might dig that, Julie, if you haven't checked that one out yet. I think that's a really powerful way of working with people with trauma. Good question, Henry. I think also people listening, if you have some great books, feel free to pop them in the chat. There's so many good ones out there and increasing in this field. All right, here's another good question from Rach. Do you have a preferred somatic experiences training online? Is it even possible?
You know what? I haven't done any of the online training. I was fortunate enough to complete my training before COVID happened, so I'm not really familiar with what the various online training modules are at this point.
I know. And also somatic experiencing seems like it would have to happen with hands-on in real time in a way. Any other questions? Please feel free to pop them in there. Oh, I just got someone else's one. Oh, such a good way to look at that. What did we even say? Fluence, a book called Fluence. Here's another thing. Peter Levine is doing one through PESI. Oh, that's cool. Beautiful. So I think unless other questions show up, oh wait, here comes a good one. Could you speak more about the paths non-therapist nurses have taken to learn and incorporate counseling skills into their nursing practice? Would love to learn from others' experiences.
Yeah, so I had mentioned somatic experiencing. Haikomi is another training, internal family systems. I know for sure all three of those don't require you to have like a clinical background. Not organic, and there's I'm blanking on another one, but there's a handful of them that are all really similar to each other that don't require like you having a therapy license or a psychiatry license.
I believe there's a branch in craniosacral therapy too that moves more kind of in the Hakomi direction. I can't remember what it's called, but there's a similar paradigm there, I think.
Kind of biodynamic craniosacral, maybe?
Oh, yeah. Yeah.
Oh, yeah.
Here is one more question. Would you consider yourself a shamanic practitioner?
I think that's a loaded question. I definitely wouldn't consider myself a shamanic practitioner. I think, again, that takes quite a bit of apprenticing within an entheogenic culture. I've been very fortunate to get to work and receive healing work from shamanic practitioners, but I myself don't identify as a shamanic practitioner. I culturally don't feel like that's appropriate for myself to identify, as well as from a training background. I haven't spent and committed the same amount of time to train within those modalities in the same way. So.
What would you consider yourself then? Is there a name for who you are and what you do?
I guess I have some identity searching to do, because I know that I've gone through my phases of getting over whatever sort of imposter syndrome issues I was having. But actually, I will tell you what I consider myself, and this is one that's been a clear message to me for years, which is I consider myself a world bridger. There is something about my role that I feel has always been really clear, is that there is a way in which that I can speak both to clinical audiences, whether that be the world of academia and the hospital setting, as well as I can speak to people that are coming from traditional cultures, even the underground culture. There's a way in which people feel safe disclosing to me. I feel comfortable having conversations with people coming from a recreational setting as well. And then there's a way in which I'm also a world bridger. I think I'm pretty comfortable in terms of being within different communities. You can throw me into a room full of funders, high-powered funders, and you can throw me into a room of kind of community members. And so, so I like to really see my role as being a world bridger between all the different facets of psychedelia.
I love it. Rach M answered in response to my question for you is a nurse.
Well, of course. I'm so proud to be a nurse. So proudly a nurse.
Wow.
It took so long. I'm the child of 2 physicians, and my grandmother was a physician too. I was the family's last hope of continuing the doctor line. And I was pre-med, and then I decided to back out. I hit organic chemistry, and I was in school in Colorado, and I was like, F this, I'm gonna go play in the mountains. No more pre-med. And then I decided to become a nurse practitioner, and I would never change that. I'm so proud of being a nurse practitioner, and it took my parents almost a decade, but now they totally understand and they see why. I would say the only little tiny thing that has ever made me question it has been more around random things about being an entrepreneur and small business owner, and that there's certain aspects of legal structure, and if we could have incorporated as a medical corporation in the state of California, because you have to incorporate as a professional organization, would have been easier. And that's the only thing, though. Otherwise, I'm so in love with being a nurse practitioner. So
I love it. Thank you for that answer. One more question, and then I think we'll wrap it up. This one is from a random Facebook user. How do you feel about holotropic breathwork practices as additions to what you've already said? I think regarding additional trainings or experiences.
I totally think holotropic breathwork is an incredible modality. I don't have a ton of experience with it. I was lucky enough to get to do a weekend with Stan Groff at CIS a few years ago. And one of the things that I really appreciated about it is that I could see it as such a useful integrative tool. I think both ways. It can be useful on the front end in introducing somebody to an altered state of consciousness so that it's a little less scary for them when they actually enter into one for the first time. And then as well as on the integration side, it can help people push up against some of the edges of the altered state, some of the material that they were working with, but then using your breath, you can titrate that. And I know that both Annie and Michael Midhofer have done a tremendous amount of training and work within holotropic breath work and a lot of the other people that I look up to in the field as well.
So heck yes for holotropic breathwork or breathwork practices. Well, we have reached the end of our hour together. It's been such a delight. Before we hang up the phone here, I'd like to ask you one final question, and that would be if you could speak to yourself as a younger nurse just starting out in this direction, what would be important for you to hear?
Keep your eye on the prize. And that was what I kept telling myself. I remember being in nursing school, and when I finally made that decision to go straight into the master's, I was like so overwhelmed. I was like, why am I doing this? Like, aspects of being a nursing student can feel really catty at times. I don't know if you guys had that experience at your programs, but I really held on to and I held into my mind that I personally felt like if I wanted to get into this work, the path as a nurse or nurse practitioner was a really great way to do it. And so rather than get caught up in clinical rotations and collecting hours and the process to licensure and even the commitment to those first couple of years of work, you're inevitably, I think there's an aspect of like my ER experience and my experience in the VA that was really important. It didn't necessarily have anything to do with psychedelics. And so remembering that all those experiences are going to help inform, you one day working towards bringing in the psychedelic work when you can, and that it's actually really fruitful to be with each part of those stages and just trusting that you'll still make it there one day to get to do the psychedelic work. It just might take a few years, but it took several years for all of us, for Angela and I, everyone. And so that's
keep your eye on the prize. Keep on keeping on. There's one last question I think would be great to answer if you would. It's about Sage. Would you be open for one more? It's really quick. It's has Sage integrated community practices like integration circles, meditation groups, hiking groups, anything like that?
Totally. Yeah, we used to do Erie would come do monthly psychedelic integration circles over at Sage Health when COVID wasn't a thing. We currently online have a monthly ketamine integration circle, and it's specifically geared at people who've therapeutically used ketamine, so not necessarily in the recreational setting. And then one of our goals is to continue to build our community program.
Is that just for your own?
No, it's not just for clients.
Okay. No, if people wanted to learn more about that, they could just go to Sage and learn more.
Yep, I believe it's on our website, and I think it's the first Thursday of every month in the evening.
That's awesome.
Yeah, I believe our acupuncturist facilitates it. So
how wonderful.
Yeah, and so when we're in person, we'll do even more community programming again.
It's coming.
Yeah, that's one of our goals. Is that's an important piece to it.
Absolutely. Thank you again so much, Julie. Maybe we'll see if we can coordinate that panel. That would be super fun. And everybody listening, thank you so much for your time. We'll keep our eye on the prize, right?
Definitely.
All right.
Nice to see everyone.
Yay. Thank you. Bye.